All right, well, it's great that we've gathered today to talk about perinatal anxiety and depression because it's very important, something we see very commonly in general practice and the community, and unfortunately it's often under-recognised or undervalued. The kinds of reasons I'll identify people suffering from anxiety and depression symptoms might not be what people classically or expect when they think of someone who's anxious or depressed. It might be that I'm seeing a mum who's had their child 6 months ago and experiencing a lot of tiredness, which maybe they thought was normal as being a new mum, but might actually represent part of the spectrum that includes anxiety and depression. Other symptoms they might have identified apart from the troubles with tiredness is difficulty sleeping or hard time concentrating or coping with looking after their little one, feeling of overwhelmed or being guilty. They might have noticed a change in their appetite or weight, which might be different to what they'd experienced previously.
You raise a really important point, Paul. I think knowing the signs and symptoms is really important so people can identify early that they've got a problem. So certainly if they've got a low mood that persists and lasts for a period of time, that would be something that they need to sort of consider as a problem. And then the anxiety is more around feeling very worried either about themselves or often they might present with worries about their children. You mentioned the guilt. I mean, a lot of mothers and fathers will have guilt, and if that guilt is out of keeping with what's going on, I think you need to consider that that's also an issue. As well as knowing the symptoms, I think it is important to know that whilst most parents don't harm their children or harm themselves, if they do mention that they've got thoughts about harming themselves or thoughts about not feeling safe with themselves or thoughts about being very frustrated with their children and perhaps harming them, they're of course important symptoms that anybody who hears about them in the community needs to seek